This video will discuss how to properly care for and clean a tracheostomy and stoma. This is essential for maintaining the health and function of the tracheostomy site as well as preventing infection. Before beginning, you'll need to gather saline solution, full-strength hydrogen peroxide, a clean inner cannula, cotton tip applicators, sterile gauze, a new tracheostomy dressing, and perhaps new tracheostomy ties. As always, ensure you have safety equipment available, such as your suction machine, a manual resuscitator, and supplies for an emergency tracheostomy change. Wash your hands and put gloves on before beginning. The tracheostomy ties only require changing if they are soiled or wet. This is how you change them if need be. Always ensure that you are holding the tracheostomy to avoid accidental decannulation. Loosen the ties and gently remove from around the neck. Place the new tie around the neck and secure on each side. Ensure there is only 2 finger width depth between the skin and the ties. To change the inner cannula, you will need to disconnect from ventilation. Depending on the type of tracheostomy your member has, you will either need to pinch the sides of the shyly inner cannula, pull the ring of the Portex tracheostomy, or twist the inner cannula of the tracho. Place the dirty inner cannula aside for cleaning. Immediately replace the inner cannula with a clean one. If your member is ventilated, replace the ventilator circuit before resuming. Now let's look at how to clean the stoma. Pour some saline solution into your container. If your member uses a dressing, remove this first. Use either a cotton tip applicator or a gauze pad soaked in saline solution to gently clean around the stoma. Start from the center of the stoma and work outwards. You'll need a new cotton tipped applicator for each quadrant. Once all 4 quadrants are cleaned, follow the same process with dry gauze or cotton-tipped applicators to ensure the area is completely dry. Now you'll need to replace the dressing. Throughout the process of cleaning the stoma, check the skin for any signs of redness, irritation, or infection. If your member has a new tracheostomy, you may only have a couple of inner cannulas. With time and each tracheostomy change, you will slowly build up your stock of inner cannulas to rotate within. First, you will pour full-strength hydrogen peroxide into one clean, empty container. Next, you will pour your saline into another clean, empty container. Please note you should be using fresh hydrogen peroxide and saline solution each time you clean your inner cannula. They should not be reused. Submerge your inner cannula in the hydrogen peroxide and allow to soak. You can allow the inner cannula to soak while you're completing the rest of your tracheostomy care and your stoma cleaning. After soaking, use a brush to clean the inside as well as the outside of your inner cannula. Next, rinse the inner cannula in the saline solution to remove any hydrogen peroxide residue. Shake off the excess saline and store in a clean container. Wash your hands and clean up.